Thank you, Judy. Let me, if I can, start with the obligatory IOM public statement, and then I'll go to some personal comments. As co-chair of this study and of this committee meeting, I'd like to welcome everyone for joining us today for this public session. The task being undertaken by this committee for the Institute of Medicine of the National Academies is to examine the current state of end-of-life care and to explore approaches to advance the field. The committee's statement of task is indicated on the information sheet that, in my understanding, has been handed out to each of you. In addition, I want to note that this is an open and on-the-record session. Interested individuals and members of the press have been invited to attend as observers. This is not a news conference, however, and we will not be entertaining questions from the floor. Reporters who would like to talk with members of the committee are kindly asked to contact the National Academy's Office of News and Public Information. I would also like to remind everyone that this is an information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee is just beginning its work. In fact, today is our first meeting. As a result, we have not made any findings or conclusions, and it would be a mistake for anyone to leave here today thinking otherwise. Comments made by me or any other individual on the committee should not be interpreted as positions of the committee or the Institute of Medicine. In addition, committee members typically ask probing questions in these information gathering sessions, which may not be indicative of their personal views. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee then must respond to this review with appropriate revisions that adequately satisfy the National Academy's Report Review Committee before it is considered to be a National Academies report. We fully expect that this is going to take 15 to 18 months. It is a very serious topic and one that we tend to handle in a very serious and substantive manner. Now, if I can transition. From a personal perspective, as one of the two co-chairs, I come to this panel with a varied background spanning the public, private, and not-for-profit sectors. I have significant experience in the healthcare area in all three sectors. For example, as Comptroller General of the United States, a trustee of Medicare, Assistant Secretary of Labor for Pensions, Health, and Employee Benefit Plans, among other things. When I agreed to co-chair this panel, I noted that I felt it was critically important for the panel to address at least three key dimensions of the end-of-life issue, or final phase of life, or however you want to refer to it. These were quality, compassion, and cost. In my view, we need to address all of these issues in a comprehensive and integrated manner. Since agreeing to serve as co-chair, I found that virtually everyone who I've interacted with has an end-of-life story concerning a family member or a friend. Some of them were positive, but not all of them were. In my view, a key part of our effort should be to capture these stories in order to help bring this issue alive and make our topic more engaging to the public and with policymakers. We also need to use common language and to avoid many technical terms and acronyms that serve to confuse rather than enlighten the reader and listener. It seems that most people agree that no matter what age a person is, and absent a sudden and catastrophic death, people should be able to die with dignity, without undue pain or suffering, with family and friends, and hopefully in a place where the patient would prefer to be. This includes not being subject to actions that, based on prevailing evidence, do not meaningfully improve or extend life, and other activities that might place an undue financial burden on others. As a result, we may have to explore the differences between access and opportunity and payment and financing options. Our panel's charge is to address the end-of-life issue. In this regard, it's important to recognize that we all die. End of life is not optional for humans. It can come at any age and in many different circumstances, and it is non-discriminatory in nature. We must also recognize that many of the challenges that relate to our end-of-life charge also apply to the broader health care issue. The truth is our health care system does not have appropriate incentives, adequate transparency, or appropriate accountability mechanisms to assure that it operates in an efficient, effective, equitable, compassionate, affordable, and sustainable manner. Therefore, some of our findings and recommendations may also have broader application. In closing, the end-of-life issue represents a very important, complex, and controversial issue. Unfortunately, it has also been a subject that has been demagogued by some. As a result, it is fully appropriate for the Institute of Medicine to address this issue. The Institute's charter and credibility serve to guarantee that its voice will be heard, and hopefully our report will be heeded. I'm privileged and honored to be a co-chair of this panel along with Dr. Phil Pizzo and to serve with a number of distinguished individuals. Now what I would like to do is to have each of our committee members to be able to briefly introduce themselves, and to the extent that they want to make any comments, to be able to do so. And Carla, I would ask that you start, please.